why do we think MDMA might work for OCD? Well, that's building on the literature of MDMA for PTSD. MDMA is not FDA approved yet for PTSD, but the trials are promising. There are a couple theories about how that works. What can we learn from mouse models? The human MDMA experience in therapy is pretty complex, and we think there are at least two components. One component is this entactogenic effect, and entactogen means touching within. And the idea comes from, they noticed that people on MDMA were able to touch traumatic or difficult memories without the pain that usually engenders. So that's one aspect of how MDMA might work, is that you can deal with these memories. You can reach out to other people, which may be painful, and form social bonds. You can approach people, memories, in a feeling of safety. It's one mechanism. And we can model that in mice as social approach, for example. The other big idea, I would say, in how does MDMA work is fear learning. How do we conceptualize PTSD, post-traumatic stress disorder, as an abnormal, generalized response to what should be non-threatening stimuli? The way that we model this in animals is a form of Pavlovian conditioning, where you pair a tone and a shock. The tone shouldn't be problematic, the shock should be, and eventually you get transference, right? You have a fear response in response to the tone, and even in response to any salient stimulus, right? You can see how one might look at that behavior and say, that seems like something that's happening in PTSD. What people have reported is that when you give MDMA to mice who've already undergone that PTSD-like model and experience, they're already hypersensitive to these tones that they associate with shock, that you can extinguish that memory by representing what should be a neutral stimulus that has a bad association, but now you're presenting it in a safe environment. And that under the influence of MDMA, you can extinguish that association faster. That's the basic finding. So how does this relate to OCD? Again, it's taking that same two basic ideas, that there's some element of social rapport, connection. Does just the connection with the therapist experimenter, does it facilitate re-exposure therapy, which is basically the therapy they're applying with OCD patients? And also testing, can we take that same process of something that should be neutral, that triggers a very aversive response, and exposing people to it in a safe environment created by a drug, and can you accelerate that process of deconditioning, of erasing, minimizing, overriding? Can you basically change how people respond? So that's the basic idea, and we're testing that in humans. And again, we think of OCD as these pathological connections between stimulus and behavior, right? And it seems like it may follow similar sorts of rules. These are ingrained and intense, repetitive, dysfunctional behaviors that might be amenable to the same sort of therapy. So that's the basic idea. Carolyn Rodriguez is an OCD expert. There's a long-standing interest. She proposed a trial looking at MDMA in OCD. She has been one of the best collaborators I've had at Stanford. The kindness and the generosity that she gives of her time and her expertise and her support. So I'll just say that as a human, yes, Carolyn is it.